Hi everybody, it's Dr. Magnifico from jaredsfullvet.com. This is my pup, Charleston. He is 10 years old. He came in today with me. I'm actually off this week, so this is what I do on my time off. I try to take the week off before Christmas to get all of our end of the year stuff done, and then I also catch up on all my regular stuff. So one of the things I had on my list of things to do was Charleston. Charleston had multiple masses to be removed. So there's one here on his shoulder. He had one, what I call kind of thoracic inlet, so in there. He also had a couple of weird little warty bumps on his feet, so we removed them. So in all, he had 4 bumps to be removed, and he had a really nasty one on his nose. So you can see the one on his nose. It was about the size of a dime. It started as a little red spot, and it was a little red spot that didn't go away. From that little red spot, it got raised, sort of like a wart. It got wide and flat, and then it started scabbing and bleeding. I pray that it's something benign, but because it's in such a weird spot, it was really right at the tip of his nose. So it was really right where the nasoplanum, so the black part of his nose, meets the skin. There just wasn't any room left for it to grow without causing a big problem. And the longer you wait, or the longer I waited, the bigger it was going to get, the more invasive it was going to get. So for our Christmas holiday, we decided to do his surgeries. We also cleaned his teeth because he was under anesthesia. He's 10 years old, like I said, and he's got beautiful teeth, so he's never had a dental before. He's actually never been under anesthesia except for his neuter. Doing surgery is always a nerve-wracking thing for all of us. Doing it on your own pet is especially nerve-wracking, so I always like to do it on a day where I'm not doing anything else, where I can really just sort of focus on them. We put an IV catheter in him. We ran some fluids. I did pre-op blood work yesterday, so we got a whole blood work panel. Went over all the little lumps and bumps, and then we decided to get it all done in one fell swoop. So 4 mass removals, and then one on the nose, the big one on the nose, a dental cleaning. We found a little dental mass in him, so we removed that. And then he's on IV fluids. I just gave him a little bit of sedation so he'll wake up quietly. He was also given an injectable non-steroidal anti-inflammatory, and that's our day. So I would say the whole cost of his procedure, if I wasn't me and I was doing it for you guys, probably the mass removals are each about $50 each. I use the laser, which is faster and it doesn't bleed as much, so that adds another $100 or so. IV fluids, IV catheter, Propoflow, which is an injectable anesthetic agent to induce them. That all adds about an extra $200. I'm going to send out 2 biopsies, the one on the nose and the one in the mouth, because I'm not sure what they are and I want to know what they are. Biopsies are each $200 each. So I would say if he was a normal client's patient, it probably would be an $800 endeavor. $400 of that is really in the biopsies, which makes it expensive. Yesterday, the pre-op blood work was about $200, so about $1,000, but this is my Christmas present to him. We're going to get him all caught up, and hopefully he'll never need anesthesia again. The other thing that's important to talk about was he's had these bumps. So the bump that I removed from his shoulder, he's had them for a long time, like 3 or 4 years. They were about the size of a nickel. They were pretty firm, but they never changed in size or consistency, so I just sort of let them sit and wait until we came in and did anesthesia. Ideally we want to do anesthesia once and then not do multiples in a year or multiples in a matter of months, because it's just a lot on them. The other thing that I could have done was I could have done a fine needle aspirate, so put in a needle into those masses, try to pull off some cells and get some idea of what I was doing, but they hadn't changed in size or consistency. They weren't bothering him, so we waited. Thankfully, they just ended up being lipomas, so little fatty masses, and they were very easy to remove. So that's his story. It's always a little harrowing to do surgery on your own dogs, but that's what being a vet is for, and nobody would take care of him, I don't think as much as I would. I'm too emotionally invested in him. So he's going to sit on my lap and wake up for the next little while, and then we'll get his biopsy results back in probably about a week, and we'll go from there. If you have any questions on mass removals or extras for surgery, or what ideal care is, or what your options are for cost, you can find me anytime at pavli.com, or you can make an appointment to see me here at Jared's Full Vet. Happy holidays, everybody. Take care, and wish my little Charleston luck. Say bye, everybody. He's sleeping. Bye.